Good afternoon, ladies and gentlemen. I'm very glad to welcome you all to the Chemistry Australia webinar on mental health today. My name is Samantha Reid and I'm the Chief Executive Officer of Chemistry Australia. Now, before we get started, I would like to begin by acknowledging that I'm hosting this meeting from the lands of the Dja Dja Wurrung people, and I wish to acknowledge them as the traditional owners. I'd like to pay my respects to their elders, past and present. I also acknowledge the traditional custodians of the various lands on which you will work today and the Aboriginal and Torres Strait Islander people participating in this meeting. Thank you for joining us today to discuss the important topic of mental health. Also joining us today from Chemistry Australia are Nick Zovko, our Regulatory Policy and Stewardship Manager, and Susan Course, Responsible Care and Regulatory Policy Advisor. Mental health has become an increasingly important priority for business in Australia, particularly in light of the significant changes to work and workplaces during the pandemic. Today, we've invited two special guests to share their insights. But before I introduce them, our members tell us that during the pandemic, there has been a visible increase in the reporting of mental health issues in the workplace, along with an increase in requests for mental health support. At Chemistry Australia, we regularly survey members on mental health practices, and we know that many of our member companies have some level of workplace support in place. The challenge for everyone is how we respond to the increasing demand for support. So I'd like to introduce our guests today. Jennifer Lowe from the Australian Chamber of Commerce and Industry will walk you through the basic employer obligations by jurisdiction. And Dr. Zena Burgess from the Australian Psychological Society will discuss strategies businesses can put into place to support workplace mental health. It's now my great pleasure to welcome Jennifer Lowe, Director Workplace Health and Safety and Workers' Compensation Policy at the Australian Chamber of Commerce and Industry. Jennifer has been involved in drafting of Safe Work Australia's National Guide, new model code of practice and regulations for psychological risk, and consultations to develop codes and regulations in New South Wales, Western Australia, and Victoria. Jennifer wrote the initial draft for the first unit of competency on work-related psychological health and safety and sits on the Standards Australia Committee responsible for work on the international standard ISO 45003. Jennifer has primary qualifications in psychology and safety and is an associate member of the APS. Please join me in welcoming Jennifer.
So what I want to start with today is, as Sam was saying, there's been a lot of focus on COVID and how that's exacerbated mental health issues in the community and more broadly, and really brought it to the attention of workplaces. What I've been wanting to do for some time now is really articulate, I guess, the issues that businesses and employers face in navigating the mental health landscape. And what we've done is produced a report which we released in October, titled Small Business Mental Health, Navigating the Complex Landscape. And this report really tries to unpack the complicated issues of a small business employer, for instance, or an employer generally, looking after their own mental health and well-being, having to manage and support their staff, and also having to deal with the landscape in terms of all of the relevant pieces of legislation. So that's really what I'm going to use as the basis for my discussion today, and I encourage you to take a look at that report. So in this slide, what I'm trying to highlight here is all the various pieces of information that's available, as well as the legislative obligations. So on one side, you can see the public mental health or the community mental health perspective. And here we've put mentally healthy workplaces, although there's a bit of confusion there over the language used, because some regulators have started to adopt that terminology to also cover legislated obligations. But historically, when we're talking about mentally healthy workplaces, and from ACCI's perspective, we look at it as public or community health promotion that occurs in the workplace as the key setting. So that's very much general community mental health and supports, and nice to have wellbeing activities. And then on the right is where we have the workplace regulation. And this covers not only work health safety, but also the Disability Discrimination Act and state and territory equal opportunity legislation, the Fair Work Act nationally, as well as some odd jurisdictional additions, and then the workers' compensation laws and the National Privacy Act. So really what we've seen throughout the pandemic is an increase in the prevalence of mental ill health in the community more broadly. And businesses have certainly not been immune in terms of employers have really noticed the pressure increasing not only on themselves but on their staff. And it's been this kind of perfect storm of increasing community, family issues, as well as workplace obligations increasing, and increased regulator attention to compliance and enforcement in this space. So this slide is really to highlight that what we've seen throughout COVID is a lot of kind of factors which include, potential loss of employment or standing down of staff, isolation, so lack of engagement if people particularly are moving to work from home and no longer going into the workplace, and then all of the other stresses that come with lockdowns and the restrictions. And I'm sure Zena might talk to this further in her presentation, so I won't cover the public community health side as much here, but just to highlight that it is something for businesses and employers to be aware of, that it's not just those workplace legal obligations, but also being conscious of the context in which we're currently operating. This slide just briefly covers the fact that there's been an increased Australian government response. So we've not only seen more media coverage of mental health issues, which is again complicating because of the interchangeability of language being used, which is something ACCI's been quite passionate about in terms of getting some consistent language to clarify what is a workplace obligation, so a psychosocial risk management framework, for instance, versus mental health and wellbeing and general wellbeing support. So really trying to get that language right. And with that, I might quickly move through to the workplace obligations, and I'm happy to answer as many questions as needed when we get to the Q&A part. But what I'll start with briefly is the disability discrimination and equal opportunity legislation. So this is one aspect of what employers will need to grapple with in the workplace, and it's an area that hasn't historically been well tackled. So although there is a lot of good government support and programs available, they're very underutilised and under-recognised by employers. So that's something that ACCI is working on actively as well, to increase the awareness of supports in the disability employment space to hopefully help increase participation. So what we see here is essentially it boils down to the Act prohibits discrimination on the ground of a failure to make reasonable adjustments. And what is reasonable will be dependent on the facts, but normally it's that it wouldn't impose unjustifiable hardship, which technically could be a range of things, but most often associated with cost. So when you're looking at modifying the workplace environment, for instance, it might be seen as an unjustifiable hardship to install a whole lift, for instance, instead of stairs in a multi-storey workplace for someone who's physically unable to go up and down the staircase there. Although we would argue that there is a range of alternatives, such as working from home is a great example. So there are ways around it, but it is quite complex, and it does typically require some expert advice, as with all kind of medical and disability related issues in the workplace. So here, what we saw, which would not surprise many, is there is confusion when it comes to employing people with disability. First of all, it's confusing as to what is a disability, or what is considered a disability under the legislation. So We urgently need clarity on that. And then there seems to be a lot of confusion for employers around what is the duty of care, how does the work health, safety and risk management process work when you have someone or look to employ someone with disability in the workplace, and then what workplace adjustments are needed, and that potentially is seen as a barrier in terms of costs and liabilities. So that's one part that employers will need to consider. Another aspect is the workplace relations laws and privacy laws. So this really, in the context of mental health and mental health conditions, is around being aware of the minimum employment entitlements. So that might be sick leave, carers leave, compassionate leave, or even the ability to request flexible working arrangements, being conscious of the protection from dismissal due to temporary absence, abandonment of employment processes might well kick in as well, as typically you might see someone with mental health conditions taking long periods of absence. General protections and unfair dismissals are typically where we will see most cases present. So that's where it does become quite tricky for employers, mainly on that reactive side there. Then we get to work health safety. So we have seen a huge increase in the activity in the work health safety area in the last couple of years. So what we've seen highlighted here is New South Wales were the first jurisdiction to publish a new code of practice on managing psychosocial hazards at work. I was heavily involved in that process along with colleagues, and Safe Work Australia has been keeping a close eye on it. Then you've also seen Queensland, WA and the ACT indicate they will be moving towards their own codes of practice. And unfortunately, because we operate with state and territory legislation, we don't get that 100% consistency in the codes of practice or model legislation. But encouragingly, the codes, although they did start off with quite a few deviations and inconsistencies, they look to be more and more consistent as the other jurisdictions work to finalise their code, and Safe Work Australia also looks to finalise theirs. So where I guess I'd highlight for you to keep an eye out on is how the jurisdictions label common psychosocial hazards. So some jurisdictions are picking up other hazards, such as insecure work has come up. Unsure yet whether that'll make the final cut, but there are some disputed, I guess, common hazards in a number of those state and territory codes to keep an eye out for. Then we also have Victoria and ACT who have indicated they will be drafting their own regs, and Victoria has begun public consultation on this. So that's at a state and territory level, and then we have activity at Safe Work Australia level. In late 2020, so Safe Work Australia members did agree to develop a model code of practice on psychosocial hazards, and that is in its final developmental stages. We also saw the Work Health Safety Ministers agree to the Boland recommendation to introduce model regs, and that again is in final stages of development, going to PCC for drafting. So we hope to see that in early 2022. And that is just indicated here on that framework where we see you have the Act, regulations are currently with PCC for drafting, and the model code is expected shortly. What we've also seen more recently is this broader framework be articulated. And we are seeing more and more documents being produced, which for ACCI is a concern, because although we do want practical guidance for employers, it is becoming a very complicated landscape just within work health safety, let alone factoring in those other broader legislation pieces that I mentioned before. So we are really trying to keep it as streamlined and simplified as possible, but still practical in terms of clear understanding for employers as to what they need to do to meet their obligations. Here's a quick list of the common hazards that we are seeing in the draft codes and in the published New South Wales codes. So hopefully people are somewhat familiar with these terms. I encourage you to become extremely familiar with these common hazards, as they will be what you will need to be across in order to be compliant with the legislation. So some of them are already covered under work health safety laws, so violence and aggression and bullying, for instance, and more recently sexual harassment. So they're coming under the umbrella now of psychosocial hazards, but also what some employers might traditionally think of as HR issues also need to be considered work health safety hazards. So that might include, for instance, poor organisational justice or change management or reward or recognition. So it's really about employers now having to change the mindset of these being HR issues and dealt with under that umbrella, and also applying a work health safety and risk management approach to these matters in the workplace. So the other ones to keep an eye out on are, you have the basic principles of identify, assess, control. But in terms of the assess aspect, we are going to see some very specific requirements built in to the regulations and therefore the codes. So you will see things like duration, frequency, severity, but there are some others that haven't quite been settled yet, but certainly to keep an eye out on. In terms of control, ACCI has strongly argued for the hierarchy of control to not be included in discussing psychosocial hazards, and it looks that it won't be in terms of the regulations or codes. The reason why we've argued this position is because people are getting so caught up in trying to think of, well, what is the hierarchy in the first place? So a lot of employers still aren't as familiar with the hierarchy of control as we would potentially want them to be, but also having to then think about how that hierarchy applies in the psychosocial risk kind of space that we find ourselves in is quite tricky for people. And either we've seen that they're misapplying, so in terms of they might think of a strategy as an elimination strategy when in fact it's an administrative strategy, and people are getting really caught up on labelling what type of control in the hierarchy these things are, rather than more broadly thinking about how do we try to minimise the risk. So we've seen this move to talk about psychosocial risk management in the context of, first we try to eliminate, and if that's not reasonably practicable, we want to minimise. So moving generally to try and get people to think about what are the controls that would fit that aim to minimise the risks, rather than again trying to apply, is it an engineering substitution PPE control. So the other piece of legislation I really quickly wanted to highlight was the workers' compensation legislation. So that has, it's always been, the poor cousin of work health safety, and there seems to be less of a focus on it in organisations, or it is grouped in with HR potentially if you're big enough to have a HR area, or potentially payroll in a lot of small businesses. So it is an area that's received a lot more attention, and we do have the National Return to Work strategy that Safe Work Australia is pushing, and there is a lot more research and work going into psychological injuries and the claims management of those specific types of injuries and stress claims or related claims. What we see here and what we really want to emphasise is not only are psych injuries complex in and of themselves and somewhat tricky to manage from a medical perspective, they're also very difficult to manage from a claims perspective. And so employers really need additional support from all the other players, so their insurer or claims agent, working closely with the GP, with VOC rehab providers, if you have one, to help to navigate that claims process and to make sure that we're not inadvertently harming the injured worker further, or potentially creating problems for the workplace due to a lack of understanding from the GP, for instance, as to what are reasonable adjustments or reasonable tasks that that injured worker might be able to do. So here the number one rule is communication. I cannot stress how important communication and consultation is in this workers' comp landscape. And to quickly highlight here, we have seen quite a big increase in mental stress claims and COVID-19 related mental health claims. So Safe Work Australia does release data each year. The latest report is the 2019-20 data, and this is showing an increase in mental stress related claims, which is the trend. I will do my movement to get light back on in the room. And then what we've seen is Safe Work Australia has also been coding for COVID-related claims, but these mental health COVID-related claims, it's a bit unclear what the specific mechanism is here. So it might be a fear of going back to work because of a fear of potentially contracting COVID, or it might be a fear of losing my job because of not being vaccinated. It is, quite unclear still as to what sits behind some of those COVID mental health related claims. So that is a lot to potentially digest in a short amount of time, but hopefully gives everyone an overview of all of the relevant workplace obligations when we're talking about mental health.
I'd now like to welcome Dr. Zena Burgess, CEO of the Australian Psychological Society. Dr. Burgess has a doctorate in psychology and is registered as a clinical and organisational psychologist. Dr. Burgess holds both a Masters of Business Administration and Education, is a Fellow of the Australian Psychological Society, the Australian Institute of Company Directors, and has worked in health for over 2 decades, delivering frontline services to both regional and urban communities. In her role as CEO of the Australian Psychological Society, Dr. Burgess is focused on system-wide linkage of mental health outcomes through reform of psychology service delivery. I had the pleasure of hearing Dr. Burgess speak at WorkSafe Health and Safety Committee meeting in September, and I'm delighted she has agreed to share insights from this presentation with us today. So please join me in welcoming Zena and for joining us today. Thank you.
Thank you, Samantha, and thank you, Jennifer. That was a great presentation, and please help me out with mine when I get to questions or anything that maybe you can assist me with. Thank you, everybody. I am going to experiment with using this technology. Fantastic. Well, I want to start off by talking about what comprises a thriving workplace. Given that we all spend so much of our time at work, it makes a lot more sense if we can actually enjoy that experience. So there's 3 components of a thriving workplace. One is around organisational productivity, which is to do with how much time people spend at work, whether they're engaged when they're there, whether there is high staff turnover, whether they can create and innovate at work, which relates to the job crafting. And a measure of organisational productivity is the number of injuries, claims and lost time. So that's an organisational measure that you can all have in your organisation, and you would have this data at hand, regardless of the size of your organisation. The next one is to do with the functioning at the workplace, which is to do with the people you actually employ, their capacity, their capability, and the access they have to support and their ability to participate in designing their work. Now, in a small workplace, there are limits on this, but it is very much about thinking about the fit between the worker and the workplace. And the third component is the worker's experience at work, whether they feel connected. Now, Jennifer talked about communication. I would put it in terms of relationships, the relationships they have with peers, the relationships they have with you as their boss, whether they feel that they can trust you, which is very important, whether they feel loyal to the organisation, whether they feel that they can be productive. One of the things that has changed...
Sorry, Zena.
Yep.
Do you want to hit that sort of take control in terms of the presentation? Because the slides.
Yes, absolutely. Thank you very much. One of the things that has changed due to COVID, I think, is the sense of the contract between the employer and the employee. There was a time when a person went to work, did their work, went home, and the two worlds were completely separate. Nowadays, those two worlds are not separate because we've been working from home and people's personal lives are more visible to their employer and vice versa. And what that means is the expectation, which is going to be shown in a lot of the legislation, is that the whole of the person is taken care of by the employer, which is a huge additional responsibility. And it's about how to put barriers on that to make it reasonable and manageable for the employer. So if you look at this diagram, it actually looks at the aspects of a thriving workplace and the common barriers and enablers. So you've got the top box, which talks about the enablers. Then you've got the issues on the bottom, and it's even hard for me to see, so I hope it's easier for you to see. I'm trying to make this bigger. That's better. You have system-wide supports, which are the policy and procedures that all organisations have, and I think that Jennifer's presentation was a fantastic guide to the kinds of things you need to have. So the policies and procedures need to match the legislation and match the health system requirements that we have. We have organisational external supports, unions, peak bodies such as member organisations, such as the one you're part of, and external providers of supports, which might be an EAP or it might be an individual you consult when needed. Within the organisation, you have internal systems, you have internal cultures of your organisation, regardless of size, job design issues, and the way the organisation is led. And the way that respect is shown in the organisation is becoming an absolutely major discussion within organisations. Values and respect is something that helps you recruit. It also is what employees judge you by. And then there's the workers' personal resources, whether they have strong coping skills, resilient skills, whether they already have mental or physical health issues and life events that can trigger them. This is the framework that is being used in the Victorian government and also in the National Workplace Initiatives set up by the Mental Health Commission, which is a large group of organisations working together. And I think it's a fantastic framework. And it's one you can talk to your employees about in terms of three themes: protecting a thriving workplace, responding to anything that happens in the workplace, and things do happen regardless of best efforts, and how to promote a thriving workplace. So everyone has a part to play, whether they're the employee, the family supports, the workplace supports, or the system supports. So this is a list of things around the outside, and if you were to sit with your staff and have a think about each of these concentric circles and what part your organisation can play, what you are prepared to do, people understand that the employer can't do everything, but being aware of all these 4 levels of things to be addressed is a good place to start. And it may be in a small organisation, you say to your staff, these are the things we can do, these are the things we can't do, these are the places we can refer you to if you need this additional support. Thank you, Nick. Next one. I've kept these 2 examples up here because they actually surprised me when I was beginning my work in this area. It just shows that what can be created across industries, it doesn't have to be within your own industry. It can be across a whole series of, not within your own business, it can be across a whole series of industries. So Mates Stronger Together is a construction support network for people working in construction, and the Healthy Heads in Trucks and Sheds, similarly, is for transport and logistics workers. So it may be that there are opportunities for people to have virtual networks outside of their individual businesses to facilitate thriving workplaces. So I thought these were 2 really good examples. Thanks, Nick. So Jennifer beautifully summarised where we're at with what happens when things go wrong, work-related mental health. Occupations most at risk are those that are frontline workers. This should not surprise you: Defence Force people, ambulance people, police workers, school teachers, because they bear the brunt of being the interface with families and kids, and health and welfare support workers. Again, people who work on the front line. So unfortunately, occupational violence is real, and we've seen a number of unfortunate incidents happen even in Victoria with the vaccine mandate. So that's becoming more widespread, not less widespread. And I'm on the board of a bullying organisation called Bully Zero, which I'm the deputy chair, and we are so busy with work-related harassment or bullying opportunities for training, because across industries and across all levels, unfortunately, this is continuing to be an issue. And the third area is work pressure, and certainly with people returning to work and feeling a little bit anxious about that, and employers trying to make up for what they perceive as lost time, people are reporting greater work pressure and trying to fit more in their day, which has also been exacerbated by the working at home, because the boundaries on work have been much more flexible. There's just some stats there about the number of claims. The trend data between women and men seems to be fairly standard. Jennifer may have more up-to-date data nationally than this. But at the moment, we're running at 6% of occupational compensation claims being mental health disorders. But in terms of the last 3 months, the numbers of claims coming in for mental health disorders have exceeded any expectations. Next slide, thanks, Nick. So bullying and violence is number one in terms of looking at what needs to be addressed. So if there hasn't been training in your organisation, or if you don't have strategies or plans for what you do when there's inappropriate behaviour, I would urge you to work on something or get your organisation to assist you, your membership organisation to assist you. When you think that 20% of workers, they have felt discomfort due to comments or humour, that's a lot given this day and age. 22% saying they've been threatened by patients or clients. Now, this data is pre us coming out of lockdown as well. So this is older data. So that just gives you some sense of it. I guess the only thing that I want to emphasise is how important this is, how it's not a transient problem, and it is something that employers need to address.
Thank you both. Thank you, Jennifer and Zena, for your sharing your insights today, and to everyone who has participated in this important discussion. I hope this webinar has been informative and valuable for you in providing your employees with a safe and healthy workplace. Finally, I'd like to thank all our members for your continued leadership and commitment to the health of workers and your communities. Thank you, and have a good day.